So hi, everybody. Welcome. Good evening. Welcome to our session on choosing health profession schools. I'm Dr. Amanda Dye. I am the Director of Advising and Programs at Beyond Barnard, and I'm here to talk with you all about making decisions around making your list of professional programs. So this event is directed particularly at those who are planning to apply to health professions programs in summer 2023. But of course, if there are folks who are planning to apply in future cycles out here with us, you can also learn some things to kind of take into the future with you. So with no further ado, I'm going to share my screen and talk you all through what we're going to discuss today. So our goals for this evening are, first, to help you all consider big picture and fine print factors that can influence your decisions about which schools to add to your list. We're going to do some practice with evaluating programs using case studies, and we're going to learn about some resources that can help you in your search to find information, especially reliable and consistent information about programs. So, pretty simple agenda. Things to consider, case studies, and then some resources and reminders, and we'll close with some time for questions. When it comes to thinking about the factors that you want to consider in putting together a list of schools, one of the things that you'll often hear me talk about is fit. And when I talk about fit between an applicant and a program, I can mean a lot of different things. And what I want to try to accomplish in today's session is to help you understand many different kinds of parameters on which you could assess fit between yourself and any given graduate program. So I always encourage people to really start by thinking about themselves. Start with thinking about your own goals, the things that you want to accomplish during your professional education, as well as in your longer term career, to help you kind of get a lay of the land for, broadly speaking, what kinds of programs are going to make sense for you. So for those of you who are interested in medicine, which is the biggest chunk of our committee applicants every year, you can think about things like whether you're interested in primary care or going into a specialty. If you're interested in practice in urban versus rural areas, if you're interested in a career that is going to include academic medicine, which typically means working in a big hospital setting versus potentially a private practice or another kind of practice. You can also think about the degree to which you want research to be part of your future career. And thinking about all of those things, there are lots of ways to learn about programs. There are lots of ways in which individual medical schools or other health profession schools can kind of make sense along any of those parameters. But one of the things that I always encourage people to think about is, like, very broadly, considering the institutional mission statement, how much of that statement do you really feel jives with what you're hoping to do as a student and later as a practitioner? How much do you feel like the institutional mission of the program is really a mission that you share individually? You can also think about things like residency programs and what programs people typically match into from a given school. If you're applying to a profession that doesn't really have a residency process, maybe you need an internship as part of your education, and you could think about what typical matches look like there. So thinking really, really broadly is a good way to get started. And then you can kind of come to some more specifics. So thinking about, like, what does the curriculum of any given institution look like? When we're talking about health professions education, I always do say these are educational systems that are really tightly regulated. So the things that you have to learn are going to be the same, no matter which medical school you attend or which dental school you attend. But the way in which those topics are introduced, the way that you'll have access to them through faculty and through other opportunities, can really differ from program to program. So when you're thinking about curricula, you can think about things like what kinds of electives you'd be able to take, right? Everybody's going to do a psych rotation and an OBGYN rotation, a surgery rotation. But are there specific electives that a particular program will allow you to take that are going to be really congruent with your interests and goals? Does the program offer longitudinal experiences? So, many schools at this point in history will allow you to start start getting into a longitudinal patient relationship from your very first semester as a professional student. And often that means, maybe accompanying a patient who's got a chronic condition to appointments when they come into the hospital setting, and working with that patient over the course of several years of your education. Those of you who really like small seminar-based kinds of classes might look for a school that has a really a curriculum that's really focused on problem-based learning. This is a fairly common kind of structure for health professions education, where essentially you'd be placed into small groups, given a problem or a case, and told to figure out how to solve that particular problem. This is a really, really student-directed and really engaging way of learning. And if you're a student from a small college who's had a lot of seminars and is really used to a highly interactive classroom environment, looking for things like problem-based learning could be a really good fit for you. You should think about things like preceptorships, which are, opportunities to kind of be matched with providers who are in the system of the educational institution and learn from them over time. You should think about whether or not a school has like standardized patient interactions. So do they hire actors to help you with your clinical skills before you actually go in to work with patients? In a sort of similar sense, how robust is their clinical skills facility? So, do they have a really great setup where, they have lots of robots that can behave as if they were having a heart attack or other kinds of medical conditions, so that you can do a lot of practice and feel really good in your diagnostic skills and kind of your immediate clinical skills before being in an environment with live patients. You can also think about things like sub-internships, which are essentially electives that you would do closer to your residency application. These will give you the opportunity to kind of preview what your professional education as a resident would look like. Other things about the educational program to consider, things like teaching modalities. Do they record the lectures? Are lectures required or optional? Do they offer any special programs or dual degree options? Many folks are interested in things like, an MD, MPH program. If that's something that you're really interested, obviously that's something you want to look for, and you want to think about, how accessible that is for a typical student in that program. You want to think about the flexibility that they allow during coursework and that timing of coursework during preclinical and clinical years. In the old days, medical education used to be 2 years of preclinical and 2 years of clinical education. It looks really different in many cases now. And, your exact set of coursework and the order in which you do those things could be really different from school to school. You'd want to think about things like how you're taking standardized tests. Many schools have at this point set a time period for folks to take step 1 of the USMLE, and that happens at a particular time during your education. Some schools allow much more flexibility about that. Of course, you want to think about accreditation status. And, if there is any probationary status of the school, making sure that you kind of understand what is ahead for a program, especially if it's a new program. Thinking about outcomes like student performance on national board exams. What are first-time pass rates like? Typically, this is going to be pretty high at an MD program in the US. But if you're looking at schools potentially outside of the US, those are definitely things you want to pay attention to. And then, of course, grading. Many schools use a pass-fail system in the preclinical coursework, and medical students and other kinds of health profession students tend to like that a lot. So looking for, kind of what's going to be expected of you as a student there. Just as a quick example of different ways that different programs kind of break up their education, this is a visual representation of the Columbia Vagelos College of Physicians and Surgeons curriculum, which does basically 1.5 years of what they call fundamentals, essentially the preclinical education. And you can see that there are a bunch of different courses that are going to be kind of happening concurrently throughout that 1.5 years. And, different overlaps, different things like that. And then in the kind of midway point of the second academic year, usually starting at the beginning of a calendar year, you would have your major clinical year, which is when you're going to do most of your clerkships and all of these different standard rotations. Columbia is a school where preparing for step 1 of the USMLE happens at a particular time, and it happens after your major clinical year. This is not uncommon because USMLE is going to ask you a lot of stuff, but it's going to ask you things couched in clinical situations. And so having had clinical experience is really helpful for preparing for that. And then the last part of the education, there's a scholarly project, which at Columbia you're given 4 months to do. And then the rest of the time until graduation, you're pursuing electives, sub-internships, things like that. And then of course, graduation and moving on to residency. Just by a little quick contrast, this is the curriculum at Duke, which does all of its preclinical curriculum in one academic year. So between the end of August and the beginning of the next July, you do their entire foundational preclinical curriculum. And as you can see, there are a bunch of things happening concurrently there. You're learning clinical skills. You are also doing, coursework on cultural determinants of health and health disparities. And then in your second academic year, you'll do a bunch of different rotations. And then Duke also includes a scholarly experience. And at this school, because there's a little bit more time when saved from the preclinical curriculum, you actually have even more time to do a scholarly project. So this is a 10 to 12 month project versus the 4-month one at Columbia. And then the last year, which is pretty typical, is going to be different electives and applying to residencies, things like that. Other things that you want to think about are research opportunities. So thinking about, past experiences that have been interesting to you and whether or not you'd be able to continue pursuing research that's of interest to you as a professional student. If you are thinking about pursuing some kind of research as a professional student, or maybe you're looking at programs that have research requirements, you want to think about how the school supports those initiatives. How do they make funding available to students to support research? And what kinds of policies does the school have for taking time off to pursue additional research opportunities? It's actually not that uncommon for people to take a year between year 3 and 4 of a medical curriculum to pursue a more in-depth research project. And this is sometimes a little bit more standard for people who are pursuing particular kinds of specialties where there's a lot of research work happening. But these are things that you can definitely think about as possibilities at the time that you're creating your list. If you are a research-focused person and you're thinking about applying to MD, PhD, DO, PhD, or other combined PhD kinds of programs, the first and foremost thing that you should consider is what your research program is. You need to have a good sense of the kind of work that you want to pursue as a doctoral student, because that's the only way that you can truly assess the goodness of fit between you and programs. The kinds of questions that you want to ask yourself are: how many faculty are at this particular program, and how many of them work in areas that are kind of in conversation with the kind of work that you want to do? How many of these people are people whose work you're familiar with? Have they already informed the work that you've done? You also want to think about how many students per year the school admits to the MD, PhD track, and how many work on areas that are adjacent to yours. Thinking about training resources, what kinds of facilities you would have access to as a student. Funding structure can be important for some people. There are a number of programs that are designated as medical scientist training programs. And these programs, or MSTPs, they are federally funded. That doesn't necessarily mean they're better programs or a better fit. It just is a designation that has to do with where some of their funding comes from. You also want to think about whether there are any MD, PhD specific aspects of the MD curriculum. For the most part, people will start in a medical school, pause after doing their preclinical coursework, and then go complete the PhD, and then come back to medical school to do clinical stuff and boards and all of those kinds of things. But, different schools can break things up in different ways. And you also want to think about average time to degree. if you're considering a combined degree, especially a combined degree with a PhD, you should know going in that this is going to be a really big time commitment, and you should think about, what's typical for people who are already in that program. Other things that you want to think about are, what are you going to have access to facilities wise? What is the situation with the library? What kinds of access are you going to have to different sorts of materials that might be helpful to you? Are there student spaces? Is there a gym? This is perhaps especially important if you're looking at schools in pretty dense urban areas. Are there going to be places for you to congregate with your classmates? Thinking about technology, whether the school offers a laptop or a tablet to incoming students, how they deliver course materials as a result of that. What are the clinical sites that you'd be rotating through as a student? Thinking about all different sorts of possibilities. There are ambulatory care centers, private or public hospitals. Some hospitals in urban areas allow students to do away rotations in rural settings. Some schools in the US allow students to do rotations in international settings. So thinking about all of those different possibilities. If you're looking at programs where the clinical training sites are a little bit more diffuse, maybe in a more rural or suburban area, you want to think about what transportation is going to look like for you. Are you going to need a car? Are you going to be able to take care of and park a car? All of those kinds of things. Thinking about student services is also hugely important. I would say it is always important to assess the availability of counseling of a few different kinds. So firstly, of course, academic. What kind of advising are you going to get for academics? What happens if you struggle academically in your professional program? Personal or mental health counseling. If you're a person who has a therapist, are you going to be able to continue working with your therapist? If you are a person who has taken advantage of counseling at other educational institutions, is that something that you want to have access to as a medical student? Financial counseling is hugely, hugely important. Professional education is expensive, and having access to resources around financial planning, especially as you get close to graduation and are thinking about starting to repay loans and making a budget for yourself, those are really, really great resources to have access to. And then, of course, career counseling. Who does the advising around applying to residencies, and how are you going to learn about what it looks like to apply for positions in your field after you've completed your training? You should also ask whether access to services like these are included in the tuition or if there are extra fees, if there's any kind of peer mentorship program at a school, that especially for first-year students, that can help you acclimate. And then who are going to be your advisors? Are you going to be advised by faculty when it comes to academic and kind of career-focused things, or are there also professional staff to help out? You should learn a little bit about what the policies are at schools that you're interested in, how you're evaluated academically and clinically. As I mentioned before, lots of schools use pass-fail grading types in the kind of academic preclinical curriculum, but most clinical evaluations are going to have, at least a few different levels of evaluation. So maybe not a traditional A, B, C, D type of situation, but something like a, satisfactory, unsatisfactory, highly satisfactory, a three-tiered system at minimum. You also want to think about whether the school offers mechanisms for students to evaluate instructors, like course evaluations of some kind, what the honor code looks like, especially if you are looking into institutions that have any kind of a religious affiliation. It's good to know what is typical there, what is kind of expected culturally. You should try to learn a little bit about what it looks like for a student to pursue a grievance process, like with grades or other kinds of things. Opportunities to do away rotations, as I mentioned before, things like, maybe if you're in a school in the city, doing a rotation at a rural hospital upstate to kind of test out your interest in more rural medicine. You should, of course, learn about medical insurance, what that looks like at the school, what it costs and what it covers, as well as policies related to exposure to infectious diseases, ever more important in the age of COVID. Many, many people, of course, will think a lot about the composition of the school. What's the student body like? How diverse is the school? What are the support services or organizations for folks from underrepresented communities? Are there committees at the school with student representation? And if so, which ones? How many of them? You should definitely be looking for schools that are trying to hear from students on a lot of different parameters of the education. You should think about the degree to which students are involved in community service, or whether there are student government associations that you can be involved with. Medical schools are often, and other kinds of professional programs, dental schools, graduate schools, they're often a little bit separate from the central institution that they're affiliated with. And so sometimes there are opportunities for students to be involved with the larger university, and sometimes it's much more insular to the professional program. You also want to think about student organizations that might support you, your interests, your identities, all those kinds of things. Location and size, I probably don't have to mention to you. These are obvious things that people think about, but thinking about, your proximity to support networks, it can be absolutely fine to apply to a school that you feel like is a really strong fit, but is far away from anywhere that you've lived before, or, your family, friends, things like that. But it can be really helpful to try to prioritize places where you're going to feel supported. You want to consider things like state of residence. Obviously, if you're applying to public institutions, you can only use one state as a state of residence, so you can't have multiple states where you're considered a resident. And you do need to look at individual state regulations on how that works. New York is a fairly permissive state, but there are other states where you have to have, for example, a certain number of years of taxes paid in that state to be considered a resident, or your family has to have a certain number of years of taxes paid. If you are a person who's from a state that does not have its own professional school, many of the professional programs have consortium programs. So like the University of Washington serves as the state medical school for a lot of states in the Northwest, because many other states like Idaho doesn't have a medical school. So Idaho residents are treated as in-state for the purposes of admissions and tuition. Thinking about setting as it relates especially to your geographic preferences long-term. So if you're a person who knows that you really do want to work in a more rural area as part of your career, training in an area like that is probably a really good idea for you. You should think, of course, about the clinical sites that match your interests. If you are a person who's really, really interested in pediatrics, are you going to be able to rotate through a well-known children's hospital at that particular school? You should think about things like the overall cohort size. For the most part, professional programs are pretty small, especially compared to undergraduate institutions. For medical schools, most cohorts are between about 100 and 300 students. Other kinds of professional programs can vary a lot. Some are much smaller and some are a little bit larger. You should also think about the total number of students in the school, kind of how big the university imprint is. There are some rare occasions where a medical school and a central university are really far apart geographically. And so thinking about, what you might not have access to if there's a big separation between the school and the rest of the university, if that's a big distance. Of course, also finances. Thinking about tuition and fees. Of course, this is where public versus private medical schools can really come into play. And I always do encourage folks to consider any public institutions at which they may be able to access in-state tuition, because those are, by and large, going to be the more affordable options. Naturally, debt levels are a little bit different between folks who attend private and folks who attend public institutions, and folks who attend public institutions tend on average to have a little bit lower medical education debt. If you are a person who's married, or if you have any children or dependents, you should definitely investigate policies around who is considered in your financial aid package, as well as things like housing availability and subsidies, and whether that's part of your aid package. This can be particularly important if you're looking at schools in urban areas where housing is just tougher to come by. And as I mentioned before, financial planning staff, are there budgeting people? Are there going to be people who are helping you to manage the financial obligations you're taking on, including managing your debt as you're getting closer to graduation? Okay, so having gone through all of those factors really, really fast, that's a non-exhaustive list, by the way. Of course, you could be considering all sorts of other things as well, but getting a sense of sort of the holistic way in which I think it's helpful to approach schools, I want to just take you through some case studies to help you understand the way that I approach assessing programs. So I've got a bunch of schools. The first half of them are private medical schools and the second half are public medical schools. I'm focusing on medical schools here just because they are the kind of biggest area of interest of most of the people who are going through our committee process. But the principles that I'm talking about here really can be applied to any sort of health professions program. So what we're going to do is take a look at some admissions data about each of these programs, including statistics around how many applications they get and interviews, as well as things like the metrics that they're looking for. And then I'll also look at some of these more kind of personality-based aspects of each of the programs, thinking about the kinds of individual degree programs that they offer, the opportunities that are specific to them, what they're saying in their mission statement, these kinds of clues that tell me a little bit more about what to expect a given school is looking for. So starting with Columbia, this is admissions data, by the way, here through the rest of the presentation that is for the class that entered in fall 2021. The data for the class that entered this past fall 2022 is going to be available a little bit later on in the semester, probably in April. That's usually when the system is updated. But there's not usually a huge change from year to year, so data that's a little bit older can still be really instructive. As you can see here, the medical school at Columbia had over 8,000 applicants for 2021, and they did about 850 interviews, so they interviewed a little over 10% of their applicants. The class that they matriculate is 138 people, which is a pretty normal size for a medical school. And they don't use any kind of early decision or early action models at all. So everybody who's applying is applying as a regular decision candidate. Columbia has a relatively robust MD-PhD program. So 14 people coming into an MD-PhD program is a decent sized cohort for MD-PhD. They do accept international students, but they didn't matriculate any in 2021. And 13% of the people who matriculated identified as disadvantaged in their AMCAS application. The class is 50% women, and my highest estimate for folks who are underrepresented in medicine based on race or ethnicity is about 30% of the class. The average debt that folks are graduating with at Columbia was $91,525. So this is the class that was graduating that year. And most of their students, 88%, receive some aid. Columbia has what they call a no loan policy or no debt policy, but that has to do with like who's assessed as not having any financial need. So even the schools that kind of have these really splashy and very robust financial aid programs typically don't mean that you're not going to pay anything for your education. Down at the bottom here is a chart that shows the median and the 25th to 75th percentile ranges for overall GPA, science GPA, and MCAT scores. And as you can see, the ranges are pretty narrow and the medians are quite high for GPA. MCAT scores, this is also a pretty high median. Things to know that, besides those numbers, one, Columbia requires a scholarly project. So most likely they're going to be looking for folks who have some research experience and have some interest in research. They also have a very small healthcare management and rural health program that folks can apply to. And so, very, very particular candidates might find a good fit with the Columbia Bassett program, which admits a really small cohort every year. They offer a number of different dual degree programs. So one of the things about Columbia is, of course, it's associated with a very large university that offers a ton of graduate degrees. And so there are many opportunities for pursuing things like the MD and PH, et cetera. The hospitals that most of the students are going to be rotating through are both local hospitals up here in Washington Heights, which is where I am right now. This is a diverse neighborhood. This is a neighborhood that includes a lot of folks who immigrated to the US. It's not a particularly high income neighborhood in all parts of the Heights. And so there's a really highly diverse patient population, and the hospital has kind of this dual role as just our local hospital here, as well as a very well-known international medical center. So really it's the crossroads of as many different kinds of patients as you can imagine. And I've got a couple of quotes here at the bottom about kind of the way that the school talks about itself, the way that it talks about its students. So I think the first quote is really important. Our students prepare to become leaders in the practice and art of medicine, right? They're really specific about leadership being something that they're looking for. They want people who have the potential to really drive the profession forward, and they're going to be looking for evidence of that as they're evaluating applications. So even though we've seen, the numbers are high and they interview a decent number of people, they have a decent sized MD PhD program, all of these things on the second slide also need to be true of folks who are going to be successful in their application process. So next up is Tulane School of Medicine in New Orleans. And you can right away start to see some very serious differences. So over 17,000 applications, which is just an enormous number of applications to imagine reading. They conduct 653 interviews. So at Tulane, the percentage of applicants who are interviewed is much lower than the percentage of applicants interviewed at Columbia. They matriculate a larger class of 190 people, and they do very robustly use early decision and early action programs. They have a pretty small MD PhD program, so they only admitted 2 folks to MD PhD in 2021, but they have 10 international students. And I know that doesn't sound like a very large number, but that is a big number for a US medical school. 10 international students in a single class is a pretty astronomical number. 12% of the applicants self-identified as disadvantaged in their MCAS application. A little over half are women, and the highest estimate for folks who are underrepresented in medicine is about 14%. You can see that the debt is pretty high. So average debt for people graduating from medical school is around $200,000 at this point in history. And it's substantially higher at Tulane, with a lower percentage of students actually receiving aid. However, you can also see that the numbers are really different. So the range of scores that are accepted, that are represented in the class, is much broader than at the previous school, and the numbers are a lot more approachable. So if a school is looking at a really broad range of numbers, right, they're not letting the numbers be the thing that really drives their decision-making process. What else could they possibly be looking for? I think there are some clues to that on the next slide. So the mission statement: we improve human health and foster healthy communities through discovery and translation of the best science into clinical practice and education. Communities is a key word here. Tulane runs 10 student-run clinics across the Gulf Coast. They have an enormous commitment to public health. They are the second oldest medical school in the Deep South, and they offer clinical rotation sites throughout Louisiana and the entire Gulf Coast. They also offer a rural medical education program. So even though, again, it's a school that is based in a city, there are opportunities to learn about rural medicine. And it's very clear to me that Tulane is a school that's not primarily interested in numbers. They are primarily interested in people who are very invested in community-based health practice. Next up, Washington University in St. Louis, which had a pretty small number of applicants, 5,600 and some change, but they do over 1,100 interviews, almost 1,200 interviews. 21% of their applicants got interviewed for a class of 123 matriculants. They don't use early decision. They have an enormous MD PhD class, which likely means that they have a very big program that is very expansive and covers lots of areas. They have a large group of international students, a very small number of students relatively who self-identified as disadvantaged on their application, about half women and about 30% underrepresented in medicine. They have low educational debt relative to other programs, and they have astronomically high numbers. So very, very, very high median GPAs, and again, a very high MCAT score. But I think one of the things to notice about this program is, they're getting a smaller number of applications altogether. It seems likely that this is a program where applicants are self-identifying. This might be a school where people see these numbers and think, kind of count themselves out, or maybe think about those of us on the East Coast not having a lot of knowledge of St. Louis and being worried about training in a different kind of area. And so it seems like there's a lot of self-selection going on in the process of who's applying to this program. So who are those people likely to be? Some of the keywords that I drew out from their mission statement are things like innovative leaders, critical thinking, creativity. They have, as I mentioned, relatively low student debt, and that's been the case for a very long time. They have an initiative, a student-led initiative, 500 Women in Medicine, which is about women's leadership within the discipline. Research is not a requirement of this program, but 95% of their students do participate, and that includes everybody, as in addition to that very big, robust MD-PhD program. They do have a mentorship program to match first years with second years and kind of help ease that transition. And they have clinical sites that really center on St. Louis. So your training would definitely be conducted there, but they also offer pretty robust opportunities for international experiences. Next up is the last of our private institutions. This is a relatively new medical school, Keck School of Medicine at the University of Southern California. And they had a robust number of applicants, 9,500 and some change, and they interviewed about 7% of those applicants for a class of 186 people. They don't use early decision, and they have an MD-PhD program, but it's not a huge one. 5 people admitted in 2021. They had 1 international student, a highly overrepresented group of women in the 2021 class. That may change. You might see that number get closer to 50% in 2022. But they have about 26% of their class who are underrepresented in medicine. They have a, higher average grad debt, over $250,000, and 79% of their students receive aid. As you can see here, they're pretty decent ranges for these numbers. The GPA and MCAT scores are not too dissimilar to some of the schools in this area, but the range is pretty broad for scores that are accepted, particularly in the GPAs. But what is Keck looking for aside from those numbers? Service is really, really important to this school. They have service requirements that start early in the first year. They emphasize working with a diverse patient population in both public and private hospitals. They have curricular and co-curricular opportunities to bridge the humanities and sciences. And they have a lot of emphasis on student wellness. So I think this is maybe by virtue of being a newer medical school, a school that has been developed during times when we've had a lot more conversations about wellness in educational settings, particularly within health professions settings. They really do consider health from a lot of different angles: mental, social, physical, spiritual, financial, and academic. So they have resources and counseling for all of those different kinds of areas. And if you're a person who's really invested in wellness as a student, this could be a really interesting program to consider. All right, now moving on to some of the public institutions. A nearby public institution, the University of Connecticut School of Medicine, which had almost 5,000 applicants and interviewed about 7.5% of them in total, but more than half of those interviews were with in-state candidates. They matriculated a class of 110, of which 81% are in-state folks. They don't use early decision. They have a moderate MD-PhD program for a school of this size. They do accept international students, so this is an important thing to know. The difference between schools that accept and don't accept international students are not a clean divide based on public versus private lines. There are private schools that do not accept international students and public schools that do. Their class this year is also pretty heavily represented with women, and about a third at highest estimate are underrepresented in medicine. This is a school that has pretty reasonable debt, so 136,000, definitely lower than national average, and a decent range in the scores that are accepted, pretty moderate MCAT scores here. Things to pay attention to when you're looking at this school, some of the keywords. They talk about innovation, discovery. These are things that lend you to understand that a school is really interested in research, right? And so they say in specific, we're committed to the belief that physicians are scientists. They shifted their curriculum in the past decade to prioritize team-based learning, problem-based learning. So this is a school that could make a lot of sense for somebody who's really interested in those models. And they offer a longitudinal patient experience that takes place over the course of 5 years. They've got mentoring opportunities. They've got opportunities to get involved in clinics, including a migrant farm workers clinic. And so lots of things that you might not expect from a relatively small state, but things that are really unique, I think, to this program. Rutgers, New Jersey Medical School is up next. They get a somewhat larger pool of applicants, almost 7,000, and about a quarter of those are in-state applicants. They interview 11% of their applicants, and over half of those are folks who are New Jersey residents. The class that they matriculate is about 83% New Jerseyites. And one of the things to notice about NJMS, if you're interested, particularly if you're from New Jersey, is that they matriculate 98 people from alternative admissions. They have a very robust early decision program. I would say there is no more robust early decision program on the East Coast than that of Rutgers. And so it can be a really good fit for somebody, especially from New Jersey, who's really, really prioritizing NJMS. Applying early decision can be a great idea for this school in particular. It's often not the best idea, but NJMS is the exception. They have a small class of MD PhD students. They do accept international students, a little over 50% women, and around 30% underrepresented in medicine at highest estimate. Their average graduation debt is about national average. And as you can see, really broad ranges of numbers here, right? So these medians are, I would say, fairly reasonable numbers for the Northeast, but they also are encompassing a pretty broad range of MCAT scores and GPAs. And so with that in mind, what does NJMS look for? These are some of their keywords: humanistic, culturally competent, integrity, ethical, professional, compassion. They really care about the community that they serve. Rutgers NJMS runs the oldest student-run clinic in the US. They provide extensive service opportunities in Newark, and their curriculum really emphasizes a lot of clinical opportunities, flexibility to go out into the community. This is a school that really cares about the community that it serves and really does look closely for candidates who are going to make sense as students in Newark who are serving that particular community. SUNY Downstate is the New York version of the same thing, basically. So as you can see, the numbers aren't too dissimilar, and you end up with a class that's just slightly larger than NJMS, but about the same proportion of in-state candidates. They use an early admissions and BA MD program that are tied to specific undergraduate institutions. So those aren't options for Barnard students, but most of their class is coming from regular decision. They do have a small MD PhD program. They previously did not accept international students, but they have an international student at this point. And they have a pretty high percentage of folks who self-identified as disadvantaged in their AMCAS application. The average grad debt is a little bit higher here, so close to 230,000, and about 70% of the students are receiving aid. Here again is a school that has a pretty broad range of scores that are acceptable. And what they're looking for, these are some of the keywords, right? Brooklyn is, I probably should be the first of this list, right? They care a lot about advancing care in the community that they serve, They are really looking for students or for applicants who have demonstrated interest in communities like Brooklyn or Brooklyn itself. They provide a professional development curriculum that I think is a really, really interesting way to kind of take people from their medical education into the next stages of that education and then eventually professional practice. They emphasize that they have a lot of research options. They do actually provide a lot of funding for MD students to do research as well. And they offer a number of different specialized pathways, especially the social determinants of health. They have a big MPH program at Downstate as well. So there's a lot of talk in the atmosphere about social determinants of health and the ways in which our social systems constrain our health outcomes. And then finally, the last school is one of the University of California system. It's one of the newest schools in that system, UC Riverside, which is in inland Southern California. It gets close to 7,000 applicants, the vast majority of whom are in-state, and they interview almost exclusively in-state candidates. Of the 86 people in the school in 2021, 84 were in-state candidates. They do not use any alternative admissions. They don't offer an MD PhD program. They have one person who's classified as an international student because that's the way the medical system classifies DACA students, but I do believe that that's the status that the student has. 55% of their class self-identified in AMCAS as disadvantaged. They're pretty heavily represented with women, and a pretty large chunk of their class is underrepresented in medicine. Their average debt is low relative to other schools, and the vast majority of students receive some aid. As you can see here, huge ranges when it comes to grades and a decent range when it comes to MCAT scores. So what does the school look for? It's in the title, right? This is their kind of tagline is a community-based medical school for the 21st century. In their mission statement, they specifically mention serving inland Southern California, training physicians who are going to work there. And so this is a school that has, not just a state remit, but a really specific regional remit. They want people to come to their school who are going to stay in the area and serve that particular area. They have a very high percentage of students who match into family medicine, almost 20%, which is the most popular specialty. That's not typical of a lot of programs these days. And they also have a lot of people who match into emergency medicine residencies. They do use a pretty traditional 2-and-2 curriculum, so you would not be starting clerkships until the 3rd year, but they have a longitudinal patient care experience program that allows for 2nd and 3rd year students to develop relationships with mentors in the community and start getting hands-on experience in healthcare settings kind of out in the wild. So having done all of those kind of brief runs through of schools, I hope it's become clear that, when you're considering these programs, you want to really consider them holistically, right? You want to think about what information you can gain about each of these programs, and you want to be really critically evaluating the way that programs are presenting themselves as a way of understanding what they're looking for in applications. And so I want to talk a little bit about ways that you can do that generally and resources that are going to be helpful for you. Starting with some very frequently asked questions, things like, how GPA and entrance exam scores affect where you apply. I usually encourage people to try to include a mix of schools where numbers are pretty close to the average or the median numbers, and where some of your own scores are above the average for that school. But where they're available, using data about the ranges of accepted GPAs and exam scores is hugely important, right? Because if you take a look at a school like WashU, you can see they're looking at a pretty narrow band of GPAs and MCAT scores. They're treating that as a very, very central factor in their process. But you look at a school like SUNY Downstate and you can see, okay, they're considering a much broader range of GPAs. And so that must mean that they're giving other factors more weight. You should, of course, keep in mind that GPA and entrance exam scores can be limiting, but they're not deterministic, right? So, no matter how great the numbers are, you still need to be able to make a case for yourself as a strong applicant to each individual program that you're applying to. And when it comes to how many schools, barred students and alums may apply to a slightly higher than average number. Around 23 is typical. The national average is lower, closer to about 16 schools. My recommendation is usually that most people top out around 15 to 20 schools. 15 to 20 is about where people lose steam on completing secondary applications. So if you're applying to medical schools, it's important to know that, that the application has many, many steps. And so you don't want to overload your list. I think the national numbers also show a negative correlation between number of schools that you apply to and outcome with the application. It is not strictly a numbers game. Applying to more schools does not necessarily make you more likely to be admitted by any stretch of the imagination. If you're thinking about things like determining state of residency, as I said before, residency rules can vary state by state and sometimes school by school. So if you're looking at public institutions, check their websites, because they will usually have a page on their websites that say, this is how you determine state residency status for the purposes of tuition at this particular school. You can only be a resident of one state for the purposes of the application process. Resources that are really, really helpful. The data that I showed you before, all of the kind of numerical data came from the medical school admissions requirements, which is a subscription service, but not a particularly expensive one that I think is a really good investment for folks who are planning to apply. You get a subscription to MSAR for free if you are approved for the fee assistance program through the AAMC. If you're applying to DO programs, you can see similar kinds of information in the DO Explorer. It is a free service, but registration is required. And if you're applying to dental schools, the Dental School Explorer is a $35 a year subscription. If you are applying to other kinds of professional programs, take a look for application guides for other health professions. Many of them publish a lot of information online. Centralized application services can be a really good source of information. What's a good example? Pharmacy and physical therapy both have application services that have really robust sources of information about, GPAs and test scores and all sorts of aspects of the application process for many schools. This is what the MSAR looks like when you log in and you look at a particular school. This is the University of Vermont. You can see a lot of basic information, and you can see most of the basic info without a subscription. But if you want to look at things like the acceptance data, you do typically need to subscribe to see that. You should also definitely take a look at the financial aid resources available to you. If you're applying to medical schools, the AAMC has a lot of different financial aid resources that are available. You can use school websites to help you learn about their individual policies around aid, as well as other aspects of the application process. Some people are really interested in the U.S. News and World Report. I encourage people who use that to do so with caution, because U.S. News rankings are based on factors that might not relate to your specific needs. And, more and more schools are starting to pull out of those rankings. We haven't really seen that with medical schools yet, but we'll probably get there. Some other links, and I will send the slides around when I send the recording of this video to committee applicants. Some links here for a set of questions that previous applicants sort of wished they had asked when they were considering medical schools. A critique of using the rankings if you're interested in learning why I think that they're a little bit faulty. And then just an example of how to understand state residency using SUNY. A few reminders. Try to take really detailed notes as you're creating your school list. You're going to need this information when you complete secondary applications if you're applying to medical programs. If you're applying to dental programs, you probably won't have secondaries, so you can get away scot-free. But it's helpful for you as an applicant to have notes that you can reflect on. And this link here is just a list of kind of factors to weigh before applying. So a lot of the things that we've talked about at the beginning of this presentation, just reminders of them in a worksheet form. I also encourage folks to just keep their notes during the interview cycle. Use those notes to help them create questions. If you get interviews with a particular program, even as you're making your school list, you can really note questions that you might have for the school. Some last thoughts. creating your school list is a process that really does involve you understanding your individual priorities, ranking them, and evaluating schools based on the yardstick that you've created. Relying on online resources, I know, is not the easiest, but it is necessary in most cases because so few people are able to visit programs before applying. Although definitely take a look out on websites for things like info sessions where you can hear from admissions folks at any given program. And of course, your assessment of programs can change over the course of time, right? Sometimes people include a school on their list because they're thinking kind of maybe about it, and then they interview and get really excited about a program. So, the sort of internal rankings that you have as you're creating the list might not stay the same through the entire cycle. And ultimately, creating an effective list of schools is so important because it can really be the key to helping you have more choices at the end of the process. When people get into multiple professional schools, it's usually because they've really thought about the application that they're submitting and how that application is going to kind of hit the eyes of the folks who are reading the application, how those people are going to connect with that individual applicant, and how they're going to feel excited about that person's candidacy. And so the better you can do to find a list of schools that are going to be really excited about you as a candidate, the more likely it is that you're going to be able to be successful in the application cycle. With that, I'm going to pause. I know we're coming up on an hour, but I'm happy to take any questions. Thank you all for being here.
Dr. Dye, I have just one quick question.
Yes.
Which I think it's answering it myself maybe, but what are your opinions on reaching out to current students of schools, even if we were to not know them on a personal level and just ask them questions?
I think that's totally fine, especially folks who are Barnard alums. I find that people tend to be really willing to answer questions about their schools. I often, ask folks to connect with other people, but I know that plenty of people also will find somebody on Barnard Connect or LinkedIn and just reach out to them. I think, sometimes it may take a little bit of time if a person's in a busy exam setting, but I think it's absolutely a great idea to try to get the student perspective. And that's why most interview processes do include students in some way, because the schools know that it's really important for you to learn from, folks who are going to be your peers.
Yeah, thank you.
Yeah.
Hi, Dr. Dye. Thank you so much.
Okay.
I had a quick question. So I know you've mentioned that most, when selecting what schools to apply to, most should be, where your GPA and your MCAT score is around the median, a few should be above, and then a few should be below. What exactly, if you're applying to 20 schools, for example, what would that breakdown kind of look like? 10, 5, and 5, or more or less, or does it kind of depend?
I think it really depends on the person, right? Because those are basic guidelines, right? It could be 10, 5, and 5. It could be 3, 12, and whatever the rest is. I think it could vary a little bit depending on the person. But what I always encourage people to do is definitely to take a look at the ranges, right? Because, especially if you're looking at schools where your scores may be a little bit below the median, but you feel like there's a really strong fit otherwise, it's very helpful if your scores are at least kind of within the typical range. So if you're looking at the MSAR, that guide will give you both the 10th to 90th and the 25th to 75th percentile ranges for all of these numbers that we've been talking about. I usually encourage people to focus on the 25th to 75th because I think for most schools, that's going to be most of the people they interview.
Okay. Perfect. Thank you so much.
Yeah. Any other questions for now?
I thank you so much, Dr. Dye, also for this. This was incredibly helpful. I don't really have a question, but I did have a plug for anyone who's left in the chat. There's a YouTuber named Sydney Dong, and she has a really great video on how she kind of made like a whole Excel file, like put all these schools and like added notes to it, and how she kind of selected schools in the same kind of way, like reach safe, quote unquote, safety, and then match schools. So for anyone who has also found this helpful, I'm sure they would like that video as well.
Spreadsheets are a really, really good tool for this part of the process for sure. And I had a question in the chat about residency. So when is it worth it to apply as an out-of-state applicant for both private and public schools? Private schools does not matter. You may see that like a lot of people who are like at Cornell's medical school are from New York, but that's more about like who's applying. People tend to apply in areas where they have connections, but that's not a selection factor for private schools at all. They don't use that as part of their review process. Public schools, by nature of their funding, do tend to need to use the residency status of applicants, and so when you're considering applying to out-of-state schools, it's really, really important to take a look at the numbers for any given program. So as I mentioned, the schools, so like SUNY Downstate and NJMS, they're about, I think they were 83 and 87% in-state. That's a relatively generous number for out-of-state candidates. So, you know, 17 to 13% of people being from out of state. That's a decent sized percentage for a public school. When you're looking at other schools, so like many of the schools in the UC system, you'll see like high 90% of people are from that state. Or, you know, if you're looking at the numbers of people who interview at that program and you're seeing that the school interviews very few people from out of state, that's a clue that it's probably a really important factor for them. The other thing I would consider is if you're applying not as a state resident, but as somebody who has strong ties to a state. So for example, you grew up in a state until the age of 12 and then your family moved. And so you're not technically a resident, but that's where you were born. You have, you know, networks there, things like that. You could definitely still apply if the state school accepts out of state candidates, and you would want to, you know, let them know about your connections to the institution, to the state, as a way to kind of help them understand why you're applying to their particular program. It can be really tough if you're applying to a school where you are not a resident, you don't have any connections, and the school can't really figure out why you might want to come there. So you want to help them understand the thought process. And I don't see any other questions. And I know we're a little bit after 7 now, so I will thank you all so much again for being here. I hope it was helpful. I'll share the recording of this session later on this week with all the committee applicants, and I wish you all lots of luck in the next stages of the process. Have a good night, everybody.